All right, so now what we want is to also have a little mobility routine for the squat. Often happen that you get a little, pain inside here or in the knee or the hip, outside of the hip. If you're not making sure you have the range of motion to really go all the way down in a squat. So, right, you're gonna end up like that or too much in the toes. Usually ankle are actually not an issue. It would be more like a hip problem. So that's what we're gonna mobilize right now. First, what you can do is literally just holding yourself somewhere and throwing your feet forth and back. That's gonna create some movement. Dynamic warm-up is always nice. Get the blood in the area. You do both legs, mostly in the front like that. First thing done. Then you want to take a stance like that, and you're gonna keep both feet on the floor and press them against the floor like you want to take them together. Then you're gonna take your hips back until you feel a stretch inside here. You take it back and you're gonna get up like that. Feel the stretch, wait a little bit, and then get up from there. You can have a little bit bend in the back like that. You do a few repetitions. If it's fine, you take a little bit wider stance and you start again until you feel a stretch and you go up again. Up. Good. Second one, you want to warm up the side of your glutes to get more abduction. So you're gonna go on the floor there and you can literally just do that and get a contraction in your gluteus medius. Very important to actually turn the feet. You're gonna see, so you take your feet back, turn the feet, and get your leg a bit to the side, and from there you're gonna lift it. Don't try to move your spine too much. It's just a little range of motion and it's gonna be enough to feel the side of your glute. Try to hold the position, do a 2 times 10 there, it's enough. You're gonna feel that very much if your mobility is low. Then you get on the floor, and now you want to train the hip flexor, the one that's gonna pull your knee up. Just hold yourself like that. If you don't have a lot of range of mobility from before, you can stand more backward or here. For me, that's about a good position. And then I'm just gonna lift this one and up and try to control it. It can be that you're gonna cramp here. That happens very much because you're shortening that muscle. And we're not used to do that basically. So if it does, just do a lower range of motion. Just lift it a little bit until you're used to it and do 2 or 3 sets of 8 to 10. Same for the other leg. If you want to do a little bit extra, you can take it to the side and do the same here. It might cramp a little bit more. All this mobility can be used for deadlift and squat, and especially for sumo deadlift. It's really nice to get that body prepared to go into a little bit more extreme range of motion, or if you have a wide squat, it's even better to use those warm-ups.